Hi, everyone. Dr. Jacob Haskalavici here from Clearing. Today, I wanted to talk about a really interesting article that I saw, which was published by Seven Wire Ventures. The article here is titled, Addressing Our Healthcare System's Pain Points, How Digital Health is Combating the Opioid Epidemic and Transforming Chronic Pain Management. So essentially what they did here was surveyed the industry and look for different types of companies that are working on solving problems that occur in pain medicine in this country. And of course, as you can see, Clearing, our company is right here under care management at the cross section between value proposition and comprehensive care, which I think really is a good way of positioning what it is that we're building, which is a comprehensive digital healthcare platform for people living with chronic pain. But the reason I'm publishing today's video is because I read something in this article that was really, really interesting. And so what the article tries to do is it highlights some of the, what they call pain points, the difficulties in providing great chronic pain care in America. And one of the statistics that they quote here is they say, for example, 66% of PCPs, primary care physicians, don't feel comfortable managing patients with chronic pain. And they have a reference here, which I'd like to click on and talk a little bit about. And so here, the link brings us to the American Journal of Medical Sciences. And this is a study that was done back in 2007 titled Physicians' Comfort in Caring for Patients with Chronic Non-Malignant Pain. And so what this study did was they took 12 academic medical centers, big hospital centers across the US, and surveyed 500 primary care physicians who actually ended up completing the survey and asked them about their comfort in treating chronic pain care and the amount of education that they have in chronic pain medicine. And one of the most interesting things here is that one of the conclusions are that 57% of physicians felt that they should serve as the principal doctor managing patients' chronic pain, but only 34% of the physicians felt comfortable in managing patients with chronic pain. And one of the conclusions here is that more intensive education after entry into practice was associated with the highest comfort level in terms of treating chronic pain, and that we need to do a much better job at training our primary care doctors, or primary care doctor education on chronic pain medicine is critical in solving this problem. Now, I want to say that I absolutely agree that it is critical that we do a much better job at training our primary care physicians on how to manage chronic pain, and because they really are the first line of defense of medical care in general. But I also want to mention that chronic pain is not just another chronic illness that can be sort of bundled in with all of primary care. It's complicated. It's complex. It's difficult to diagnose. There are a variety of treatment strategies that involve the management of the biological effect, symptoms of the pain itself, the psychological aspects of chronic pain, and the impact that the symptoms have on a person's social well-being. And so what I would like to say here is that although, yes, it is very important for us to do a much better job at training up our primary care physicians on how to manage chronic pain, I think we equally need to invest in figuring out how to have primary care doctors and specialists, chronic pain management specialists, do a much better job at talking to each other and collaborating with each other. And that is definitely something that we can use digital tools to help us do a lot better job at. So thank you all very much for listening, and feel free to like and subscribe below. Have a great day.